Hi, are you getting ready to start radiation treatments, or may have already started treatment, but you're wondering if you can still enjoy the soothing splash of water and swim while you're getting radiation treatments? Well, the answer to that question isn't just a simple yes or no. So stay tuned as we dive into the secrets of swimming safely during radiation treatments. We'll go into protecting your skin, avoiding potential risks, so that you can not only swim safely, but you can enjoy the healing benefits of swimming during radiation treatments. Hi, so now I'm assuming if you're watching this video that you don't have any areas on your skin where the skin is open, where it is bleeding, where it is draining, you don't have any scars that are not completely healed, and your skin is completely intact. Because if you have any of those things that I just listed and your skin is not completely intact, you have any open skin, then it is not wise for you to swim right now because your skin in your body right now is at risk for getting an infection from those open areas of skin. So you cannot swim right now until that skin is completely healed, and you'll want to get the okay from your doctor before you get in the water. Now, if your skin doesn't have any of those things that I just listed, it is completely intact, then swimming for you is actually completely fine. In fact, if swimming is part of your routine, something that you've done, it's a great way of exercise, and it's going to help combat any fatigue that you may get as a result of the radiation. So swimming is something that we want you to continue to do because it will help combat radiation related fatigue. Now, there are a couple things that you're going to need to do so that you can do it safely, and it's going to not interfere with your radiation treatments. So the first thing that you want to do is first you want to tell your doctor that you want to swim during your radiation treatments. Definitely let your doctor know because there may be some things that they want to do differently, or if they don't do this, you may want to request that this be done because it'll make life a lot easier for you. So before you get your radiation treatments, they're going to have a planning process that they call a simulation, where they plan how they're going to target the radiation, and they need to put some marks on your skin so that the therapists who treat you every day can know where to target the radiation. Now, some places use ink and they put some tape over the ink marks to keep them on your skin. If you know you're going to swim, that is really not a good way to mark the skin because the water could take those marks off, and then it takes additional time on the treatment table to put those marks back on. And you're actually exposed to more radiation because they'll need to take some images to make sure that you're lined up safely. So to keep from doing that, you'll want to request that they do a tattoo. Now, the tattoo isn't a picture. They're not drawing a picture. It's not some big X that they're going to put on your skin. It's just a little tiny dot. It looks like a mole, just large enough for the therapist to see. Your spouse, someone else looking at you would not even see it unless you pointed it out. It's that small. It's really just for them to be able to line you up for your treatment. So those tattoos make it so easy for you to get in and out of the water without having to worry about marks coming off your skin. Very easy, but you may have to request those. The second thing you're going to want to do is you're going to want to make sure before you go in the water that you protect that skin that's being radiated with some type of barrier treatment. Typically, I would recommend something petroleum based like an aquaphor over the skin that's going to create a barrier between the water and the radiated skin. So that way it's that chlorine, salt, any bacteria in the water is not coming directly onto the radiated skin. You may need to ask the nurse or the doctor exactly what area of skin is being treated because it's not always obvious. So you definitely want to make sure that you ask them so that you're protecting all of the skin that's at risk that's being treated with the radiation. Now, if you're swimming outside and it's sunny, I would recommend that you also cover that skin either with a shirt or you find a swimsuit that covers that area so that you're protecting it from the sun, because you don't want any additional ultraviolet light from the sun irritating that skin that's being radiated. So you'll definitely want to protect that skin from any ultraviolet light radiation. You definitely don't want to swim outside midday when the sun is at its peak. Um, and when you get out of the water, then you want to definitely immediately wash off that area. So you want to wash off that skin, preferably with soap and water if possible. But at the very least, you want to get in the shower, wash the chlorine off your skin, get out of that wetsuit or that wet shirt as quickly as possible. And then you'll want to reapply some moisturizer to that area. And then lastly, if you find signs that your skin is starting to get irritated, you definitely want to stop swimming at that point, because then your skin potentially has some open areas that put you at risk for infection. So those are the steps. Those are the things that can keep you safely swimming during radiation. We definitely want you to swim if you can, because I think it will be helpful to you. You will feel better mentally, emotionally, and physically if you can continue to do that, especially if that's something that you enjoy. So I hope that this was helpful. Leave comments below if you have any other topics that you want me to cover. Share this video with someone if you feel like this would be of some value to them. I'm Dr. Tonya. I am a radiation oncologist and breast cancer survivor, and I am here to help you navigate this journey with confidence. I will see you guys in the next video.